Great. So many of you are already really wonderful users of the QI portal, so you know all the features that are there. I'm not going to bore you with what we have already. But our team has designed 4 new things for the QI portal, 4 new designs, and we'd love to be able to do them all next year, but we have to prioritize as we do in QI, and would like your feedback about which of these 4 are most valuable to you. So I'm going to show a quick video about what those 4 designs are, and then there'll be a QR code on the screen. You'll take a quick survey. I'll pass around a sign-up sheet. If you complete that survey, you'll be entered into the raffle for a $25 gift card. So not only are you with maybe the best group in general, personality-wise and otherwise, but you're in the right room to get a prize as well. If you're attending virtually, let us know if that sound doesn't go through to the video once it starts. Thank you for your time to help define the direction of future QI portal development. T1D Exchange is committed to convincing the QI portal means that best support your work, incorporate best practices and robust tools, and align with emerging diabetes care needs. In this short video, we will share 4 design visuals and will ask for your feedback in a brief 5 minutes. More and more centers are mapping to our T2D data specification and providing monthly patient-level information for people with type 2 diabetes. For applicable centers, we envision a QI portal where you can easily toggle between your type 1 and type 2 portal. Visually, different colors will make it easy to see if you are reviewing dashboard, compare, and report tab outcomes for people with type 1 or type 2 diabetes. The library and improve tab would overlap for both populations. Next, we have heard your request for more analytic freedom in the QI portal. In the New Insights tab, we envision basic analytic functions that allow you to answer population health questions and display outcomes with very visual tools. For example, this tab would allow for collaborative live analysis and visuals from US vision. An expanded database feature allows you more direct access to your data outside of our standard QI metrics in the Compare and Reports tab, support research questions, and empower you with more data access. Unlike existing QI tabs, the Insights feature will allow you to analyze across variables to more complex visualizations. In this case, comparing the % of patients displaying positively depressive symptoms and general anxiety disorder. The visualization options allow you more freedom to tell your story or give basic research insights into your population. Next, we have added many new metrics and filters to the Reports tab over the years. In this Reports tab refresh, we envision an Enhanced tab where metrics are organized into categories for easy access. Additionally, data tables under charts will be more advanced to show outcomes for health equity filters. And finally, we envision a more advanced and interactive statistical process control feature to clearly display shifts in reported timeframes and include tips to describe these shifts in your processes for presentations or publications. Finally, we believe the library is also due for makeover. We have close to 200 resources available, and we want to make sure the library is easier to browse and give you access to what you are looking for. To this point, at the top of the page will be options for viewing resources that are just for me. For example, resources you've liked or relate to QI portal projects or saved reports. You can also view top-rated resources across the collective or browse collections such as QI improvement tools or diabetes EMR documentation. Rather than searching by categories, a more robust search panel will allow you to search for resources by keywords, time frame, center type, center name, or category. Finally, additional links are available for external collections, including existing digital libraries or resource collections. You can also access our QI bibliography with textbook or other hardcover reading recommendations for additional professional development. And finally, you can contribute directly to the QI portal by uploading a PDF or web link to be a recommended resource for T1D Exchange consideration.
So you can put the travel slide. That's why we have just that slide.
I'm still like having to remind like Yeah, I don't know. I'm just talking about
Well, I'm glad to see everyone engaging. That's so good. Well, let's get started. We're gonna start now. Strengthen the role of QI champions to advance their skills. I'm gonna pass this over to
I know, I was here. I don't think that was. Yeah. Oh, maybe you guys got like real nervous. I did. Candice got time. I wasn't yeah.
All right, it looks like everyone's getting settled. I'm Whitney Beaton. I'm a clinical nurse specialist with UW Health Kids, inpatient and ambulatory pediatrics in Madison, Wisconsin, and I'm a QI champion. And I'm so excited to be here with you guys today and to kind of be leading this discussion and to get this together with everyone. And first, I'm going to give some introductions for our panel members, in case you don't know them, or maybe there are some fun facts that you didn't know, but you already know them. It was fun for me to I'm excited to share that with you. I'm using my notes on my phone, so I'm not just like, fancy at my text messages. All right. Thank you. All right. Lydia Holly began her career at Children's National Hospital. Due to her experience on the COVID-19 unit, Lydia became a magnet champion to help Children's National Hospital achieve quality patient care and nursing excellence.
In 2021, she transitioned to the ambulatory setting where she served as the charge nurse of the diabetes clinic. Lydia's experiences in the clinic furthered her interest in quality improvement, leading her to join the T1D Exchange Collaborative. Currently, Lydia serves as the clinical coordinator for the diabetes team at Children's National Hospital. In addition to her core role, Lydia manages and supports various quality improvement initiatives as a QI champion for the T1D Exchange Collaborative. Candice Williams is a certified pediatric nurse practitioner and certified diabetes care and education specialist on the Cook Children's Endocrine and Diabetes team. Candice graduated from Towson University and the Johns Hopkins University School of Nursing. She received her master's degree in nursing from the University of Texas at Arlington. Candice's passion for diabetes and children's health systems stems from her work in community service in the U.S. and abroad. As a self-proclaimed techie of the group, she serves on several quality improvement committees and enjoys learning about advancements that support her patients and families. Her love for public health led her to volunteer service in the Peace Corps, serving as a community health worker in Malawi, Africa. Naomi is a manager of improvement consulting within the Center for Quality and Safety at Lurie Children's Hospital in Chicago. She was a middle school teacher turned nurse and has been in healthcare for 10 years. In her 10 years in healthcare, she's been a nursing assistant, a bedside nurse, an operations manager, an improvement consultant, and a consulting manager. Wow, I'm tired just reading that. She has been working closely with the T1D Exchange Collaborative and the Lurie Children's Diabetes team for almost 4 years. She is passionate about improving the systems that support clinicians to enable them to provide safe and equitable care to all patients at all times. Amy Grant is a senior clinical quality specialist at Cincinnati Children's Hospital. She is a pediatric nurse with experience in cardiology, mental health, and hematology. She has a Bachelor of Science in Psychology from Indiana Wesleyan University, a Master's in Education from Xavier University, and Doctorate of Nursing Practice from Northern Kentucky University. She was a nursing professor at the Christ College of Nursing and Health Sciences, and adjunct professor for the University of Cincinnati DNP program's quality improvement course. Her QI areas of expertise are methodology and portfolio management, healthcare workers' joy in work, which we'll get to hear a little bit about, and equity for patient outcomes. Dawn Buckingham is a certified professional in healthcare quality, operations excellence, utilizing the IHA model for improvement, Lean Six Sigma Black Belt, statistical process control, and constraints management methodologies in pediatric and adult healthcare. He currently consults with several leading medical schools and teaching hospitals and serves the T1D Exchange Learning Collaborative as a senior QI consultant. Dawn is a published author and co-author of over 25 peer-reviewed journal articles and recipient of numerous quality leadership awards and speaker nationally at IHI Scientific Symposium and regionally at American Society for Quality. All right, quite the panel up here. All right. So we'll kind of start off our discussion here. Many of us work in large academic hospitals and medical centers with various levels of leadership, starting at our clinic level, sort of extending up through departmental, organizational, system-wide leadership. Having leadership participation for QI is important to the success of projects. How do you go about getting leadership buy-in for your QI project?
Thank you. Well, of course, the way to get buy-in to anything is to appeal to what a person needs that you're working with, right? I mean, everybody does things for their own reasons, as do we. And so to be knowledgeable about what the leaders in your organization need from the work you do is a key to your ability to influence. And so if you think just broadly about leadership, you can think all the way up to the C-suite. The C-suite people are charged with knowing if your organization is capable and if it's adequately resourced. Capability is just, is it ready and is it reliable? And of course, that's what you impact all the time, ready and reliable. And so adequate resourcing. The middle managers under them, they need to take those resources and allocate them. And they need to allocate them so that the supply and the demand works. The people are coming in, you have the services that can do that. So you're working to present your work and the results of your work at that level. And then, of course, on the ground, we're talking about service delivery and the QI work that the teams do. So knowing who your stakeholder or your audience or the level that you're working with helps increase buy-in.
I echo all of that, and we'll just phrase that in a slightly different way too. But I think it's, no, it was perfectly understandable. But reiterate, I was a middle school teacher, right? So you got to hear things a few times for it to go into your long-term memory. But I think it's like showing them the value or the return on investment. I think data is really important in that. And I think clearly articulating role expectations in QI. You are the executive sponsor. This is what this means. This is what the time commitment is. And this is what I'm asking you to do. I'm asking you to break down barriers. I'm asking you to whatever. And can you do that? Do you agree to do that? Or is there somebody else that has the capacity at this time to do that? I think it's really important to think about capacity. We should be less focused on one individual and more focused on the role. So are there other people in your role that have the same scope as you do or the same expertise as you do that could do the same thing that might have more capacity, right? So I think it's really a negotiation, but it's also, and then be very clear on your aim statement and your problem statement and your goal, because I think leadership really that resonates with them, that it's very clear to them, and then tie it to strategic initiatives. So if the strategic initiative this year is around US News, if you can tie it to US News, you probably have a better chance of getting some buy-in and resources.
Thanks so much. I think that being clear and succinct, right? Especially when you're talking to leaders who are doing so many things throughout the organization, like you need their support. And although it's the work that you're doing, right? And it's so important to you and you spend so much time doing it, it's like a snippet of what they need to support, right? So giving them the key points, the data, whether it's written out or pictures like from the portal, right? Can be so helpful in supporting that and getting buy-in. All right, so we've just talked a bit about getting buy-in from leaders, and now I'd like to ask you to think about things at a more local level. So how do you form partnerships within your clinics? How do you convince team members to align their actions with yours for effective implementation of your projects?
Yeah, I think in a very similar way that, engaging with leaders, it's also engaging with our team. And I feel really thankful to have wonderful partnerships, two of which with our clinic staff, two of which are here in the audience. And I think that really all thanks to talking to people and simply getting to know them and understanding what is your role? What does your day look like? What do you like about your job? What do you not like about your job? What's important to you? What's not so important? And what I'm getting at there is what are your pain points and what can we do about them? And how do those apply to the, QI initiatives that we have going on? And how can I bring you in? I think another, approach that I typically like to take is just empowering, this aspect of what you do here in our clinic is so important, and you are the expert in this. And I need to hear from you. You're on the front line. You're doing this work. Your voice in this discussion is so important, and I need you on my team. And then another, final approach that maybe if the QI project's not so jazzy or not super fun, another thing that I'll try and tap into is that intrinsic need that I think we all have within us to help and improve the lives of our patients. That's why we're all, in healthcare. So attaching that to, again, just why we're doing what we're doing, why the QI work is important, and the work that we're ultimately doing.
Definitely to piggyback off of that, but we strategically use our MAs and our nurses, so the first face in the clinic for a lot of our surveys and rollouts. And I will try my best to, before it even makes it to the first email, to verbally tell them what we're working on and why we're doing it. I've also encouraged them to move beyond just handing the survey and walking out of the room, but they have the right to engage with their families just like the providers and other nursing staff do. So I think that's been really helpful.
Thank you. Yeah, partnership. It's the key so much to everything. Think about it for a second. We all want to understand and to be understood. And so when I have that, I have a partnership. So that really comes down to the fact that I'm willing to share information and I'm willing to share decision making. And so if you're brought into a partnership, that's what you want to do, is be sure that you're understood and that you understand.
Thanks. And I think it's probably a lot of the work that we like to do in our jobs, right? Is connecting with people and learning about them and understanding what role they could play and how they could be a part of our work, and understanding strengths and building on those. So thanks for your answers. All right. Forming your team and getting staff on board with your efforts are often early parts of any QI project. What about projects that your team has already started working on that may not go as planned? How would you approach a QI project that's not going as planned?
I have two recent examples of this actually, and Riley, if I would to think about it, there'd be more than two, but in these two that I have in mind, two different strategies we've used or are going to use is we had a project that we're working on to decrease hospitalizations for patients with diabetes, and it was like a lot of variation, or we wanted to go down and it was going up. So there was just no movement. So we had to think about like refining our theory for improvement. Like we looked at our key driver diagram and thought like, do we have everything listed? Like, is our theory solid? Because if it's not, then, what's missing, whatever is missing, we're not hitting that. And that could be why we're not meeting our goal. And so we looked into the chart reviews of the patients who are hospitalized. We talked talked to some patients who are hospitalized, and just looked at like certain like failure mode effects analysis, and used the QI tools to really help us reframe how we were thinking about the project. So that was one thing that we did, really using the tools and reframing and making sure we are thinking about it the right way. And then the other way, which is maybe a little bit more fun, maybe you guys might want to use this tactic, is we're having we wanted to do it sooner, but scheduling didn't allow for it. So in January, we're going to have this booster session. So sometimes when you guys have a project kickoff, you might have like a kickoff meeting or like session just to get everybody excited. So we're going to use something like that, except we're calling it a booster session and doing it in the middle of the project. We can see we haven't quite met our goals yet. This time they are actually going in the right direction, but it's for a grant. So we have one more year of the grant. So like, what's a booster that we can do to just encourage people to keep trying new things and just brainstorm, just like have renewed energy. And then the last thing that I think you could always do is if there's, and I have done this, if there's a problem with maybe a team member or the leader not being enough engaged, or if there's just any barrier that your team is facing, you can always escalate it to the sponsor and ask for help from them.
I love that booster session idea.
I do too. I'm going to totally steal that. Backing it up a little bit further, I think when something's not going as planned, doing like a big timeout. So just kind of hitting the big pause button of timeout. What's happening? Let's get everyone in the same room. Let's brainstorm. Let's go back to our tools. I love that of like, let's look at our KDD. Let's look at our fishbone. Let's look at our process map. Do we miss something? Do we have some sort of oversight? Another tactic too of sometimes tagging a friend, a QI friend who we have tons of in this room, and having them, kind of brainstorm with you. Sometimes I find that when you're so in the weeds, sometimes it's really hard to, zoom it all the way out and be able to figure out, what's not working here. So those are some of our tactics.
Yeah. I'll just add a couple other things. I think the focus on like, maybe it's like making sure the right people are in the room. Like potentially there's a stakeholder group that you're not thinking of or that you haven't thought of that has some insights on a problem, right? Or because there's kind of, when you say unplanned, there's a lot of ways that could be, right? Like either it's like we totally missed the mark and like this isn't the right problem, or it's not the right intervention, or it's not the right, goal. Or there's a lot of other things that we've talked about with like the booster, the timeout, or it's like an ownership thing, right? Like a leadership ownership thing where maybe it's just not the right time. Maybe there's too many competing priorities. Maybe you need to leave it and come back. We hate to have like sunk costs, but like the reality in QI is that not everything you try is going to fail. Is going to succeed. A lot of things you try will fail. And I think my CMO at Lurie, Derek Wheeler, he actually came from Cincinnati, but he says all the time he would love to see more people publish on failures because you can learn so much from that, right? Like, and why do we all have to repeat the same failures? Why don't we publish on it, say this didn't work? And maybe it didn't work just in our patient population and it would work somewhere else, but there's so much to be learned there. So I think, executive sponsors, ownership, leadership, if people are not bought in at that time, I think it's okay to just come back because I always say as a QI champion, I can't care more about the work than the people on the front lines doing the work. So, there's a balance.
Okay. And notice that like probably all of us could have given an answer there, right? Like it's not like QI projects typically just make a plan and then you do it and then it's over and it all went just exactly as you thought it would. So, and we all know that the role of the QI champion can be challenging, right? And you have to wear lots of different hats and on the different days, wear different hats, sometimes on the same day, do lots of different things. How do you find joy in the work that you do?
Yeah. So me personally, I think seeing the like how what I'm doing is making a difference, if it's making the clinician's job easier, if it's improving outcomes, if it's decreasing inequities, like really knowing that my work has meaning and purpose gives me joy. And also hearing positive feedback from the clinical partners that I'm working with, like saying I'm doing a good job, or they appreciate what I'm doing, or even like if we can say that to each other, I think those words can be really powerful. And camaraderie is such like important to me. So like the clinical people I'm working with, the other QI folks, like knowing them as people and not just as clinicians, and just chatting with them and getting to know them. Actually, at the beginning of all the meetings that I facilitate for QI teams, at the beginning of the meeting, we just do celebrations. Like, you know, I just spend like 3 minutes. It doesn't take long, but I always just open it up. Does anybody have personal or professional celebrations? And maybe it's something about the project we want to celebrate, or people say, my daughter just got engaged, or, all kinds of different, I just had a birthday or whatever. So it's a good chance just to like get to know each other at the beginning of the meeting. And then, yeah, that's all the thoughts I had.
I have just a couple of things to add. In terms of like wearing different hats, I think, some people in this room are the subject matter experts. You are the RNs, the CDEs, others of us, like I'm an internal consultant, right? And I have a nursing background, but I think it's when you put on that QI champion hat, you are approaching the topic as like not being the subject matter expert, even if you are, right? And I feel like very passionate that my job is to draw information out of people doing the work every day at the front lines. And so I ask a lot of questions, and I, really want people to like see the QI process and like understand the process. So my job is to kind of guide them through the QI process, through the current state, through the future state, through implementation, but really be their coach and their mentor and cheering them on, and then teaching them QI along the way. So what brings me a lot of joy is when I see frontline clinicians or non-clinicians that don't have QI training, but they start to talk about like key driver diagrams. I'm like, yeah, like I did it. They get it, like they're talking QI, and it's really cool to see that like energy. And, I think it's ingrained in all of us to like, we want to make things better for our patients and families. So if you can tap into that energy, it brings a lot of people joy. Like it brings me joy, but it's really cool to see the joy it brings to the people doing the work too. So
definitely echoing a lot of what everyone said, but on the frontline standpoint. So I know a lot of everyone in this group and in the collaborative are clinical and do this work on the side. So we just finished their survey, and we were asking patients, like, has anyone ever told you about a pump? And we were really saddened by the data that like half of our patients that we surveyed that day had not been aware. And I just had this like fireworks inside of me. I was like, oh, we're going to fix this. Like this is going to be great. And like, that's where my joy is. Like I find the problem and I get excited about fixing it. Like, are we going to fix it this year? Probably not. But like knowing that there's something to solve and being able to connect the QI side, now that we've presented it to our providers, we're going to be able to use the language to not just say, oh, let's just fix it and move on. They're learning what key driver diagrams are and things like that. So just looking at the problem and finding joy in that.
Awesome. Yeah. Again, like I appreciate all of your thoughts there. I think for me, finding joy in the work that I do is sometimes easier than others, right? Like there are times like last week, we got to implement parachute in our clinic, and we've been trying to do that for 2 years. Like it has been a labor of love, and it wasn't always fun, right? Like, but I think what I do try to reflect on and find joy in is like, one, take the celebrations where they come, right? Like when staff are excited and when you're having wins, like feel it, let that be part of your day too. But also even in the times when it wasn't going well, I was so motivated to do that because I could see the pain that it was for our nurses, and I can see how it negatively impacts our patients to not have that stuff. And so it's like, I'm not going to stop talking about it. I'm not going to stop asking. I'm not going to stop advocating for it. And even though those parts aren't all glamorous and joyful necessarily. It leads to the end product, which is what we want to do. So I don't think there's always joy every single day in every part of it, but I do think recognizing the joy and taking those moments to see it and not to get sort of lost in the weeds of what can feel like sometimes, oh, there's so many problems and I can't fix it today or this year, but recognizing that there are things that we're doing well. So, all right, what matters to you as a QI leader? What are some of the things that might stand in the way of what matters?
So I think a couple of the things that matter, everything matters, right? But to condense it down a little bit. For me, I think data and measurement and the current state assessment or analysis or whatever you call that in your QI framework. But I think understanding the data and having baseline data and having a way to measure progress is important for ROI and value. It's also important for engagement and buy-in. It's also important to know that you're trying to fix the right problem. I think I've worked with a lot of teams that something might anecdotally feel like a very large problem, and the data shows that it is, or the data shows that maybe it's not. And so grounding yourself in what the data and trusting your data and, really is a big part of the QI journey. It also helps you celebrate your successes, because when you can concretely and tangibly see the improvement in a centerline shift on an SPC, it's like the best feeling ever, right? So it serves a lot of purposes. I think the current state assessment or the analysis phase of a project is so vital. Making sure you're talking to all the right people, making sure you're asking why a million times. I always tell people channel your inner 2-year-old, really why do you do it that way? Why? Just tell me more. And it's not a judgmental thing. Just walk me through this journey. What does this day look like for you? Why are we doing things that way? Almost crucial conversations, devil's advocate, maybe we do it because we've always done it. Maybe we do it because it's evidence-based. Maybe we do it because it's a workaround or a Band-Aid. Maybe we do it. So really chasing that trail that it takes you on. And then it takes you over to the EVS technician that you need to talk to. And it takes you to the pharmacist, takes you to, and you chase it and you really go through that current state assessment where you're really getting down to the root of the problem. Because in my mind, that's the gold star, because if you don't take the time to understand the current state and acknowledge it, sometimes it's messy. When I'm process mapping, I'm like, do we really do that? Oh, we do. We better write it down. It feels gross sometimes. And I work at a really good system, but there's still things we do that it's why are we doing that? Acknowledge it, write it down, take the time to own it, and then see how you can fix it. Because if you don't acknowledge it, then you might not be fixing the right problem. And I think that's where it gets a little, where you just don't want to put in interventions in place that aren't actually fixing what the data and the front lines are telling you is the problem. The other thing, sorry, I'll stop talking soon because a lot of other people have things to say here. Things that might stand in your way, capacity, resources. I think scope creep stands in the way a lot. We try to fix the whole system instead of just piloting or honing in on one thing. And then we can always spread if it works, right? Some of those things I think are things that stand in the way. And I think all of those are manageable through, escalation to executive sponsors or different things, but yeah.
Those two questions, what matters and what stands in the way, I've actually asked numerous teams, QI teams that, and also clinical teams that. The IHI, Institute for Healthcare Improvement, I think it was 2017 or 2018, they put out a white paper called Improving Joy in Work. I highly recommend it if you guys haven't read it. And I did a lot of study and research with the topic of nurse fatigue or joy in work or employee experience. And I actually created a framework that I use with teams I could use it with any team. Like I could go into your team clinic tomorrow and do it. I could go into McDonald's and ask those people, because the methodology is just so sound, and it really gets to what matters to you in your role and any role, right? And then step 2 of their process that I implement with teams is what gets in the way. And those first 2 questions are called the what matters to you conversation. And it's really to get at like, hey, what matters to you? What do you like about your job? What are the things that really make you feel proud to do your job? And then what are the impediments? IHI calls it pebbles in your shoe, but what are those pebbles that get in the way? And then once they like talk about what really matters and then what gets in the way of those, then I help them think of an intervention that can get rid of some of those impediments. And then we just do PDSA cycles. It's like a QI project, but I never call it that with them, because if I say, hey, do you want to do a QI project to improve your joy in work? Nobody will raise their hand because they don't have the bandwidth for that, right? So I always call it activities. So consider using that if you want to get anybody interested in anything. Call it activities instead of an effort or a project. It works. But I'll just say like a couple of things that I've heard. I've presented this joy in work framework that I've used with teams at some conferences or just with lots of different teams. And I actually wish they would rephrase the joy in work. And I know we use that a lot, but I think when people hear that, they think like giggles and unicorns all over the place. And they think it's joy at work, which it can be joy at work, but it's also like meaning and purpose and camaraderie and resilience. Like all these things are what IHI calls joy in work. So that's just one caveat to that phrase. And I do use that phrase still, but just something to think about when you're talking to people about it so they don't get confused. But when I ask the teams, these are true for myself, and I'm going off script here for a second, but we'll kind of let everybody have like a minute to actually engage with us for a second. I'm going to say like what I heard from other QI teams, and maybe just raise your hand if you yourself have felt that way too. The feeling of, this is like one when somebody said it, I was like, that is me, but I never realized it was me until you just said it that way. But they said the feeling of always having to be on, like you can't mess up, you can't make a mistake, you have to facilitate just this right way, your chart has to be just this right way. So does anybody feel the feeling of always having to be on? Another pebble that's common is lack of engagement. Maybe people aren't able to come to meetings, or like the pivotal people you need at the meetings, they're not there. You can't make the decisions. You can't decide what the next cycle should be because the person's not there. Or maybe they said they were going to do a PDSA and then they didn't do it. So anybody experience lack of engagement? Lack of understanding about our role. Some of you are clinicians, but if you are like me and just do QI, people don't always know. They ask you to schedule meetings or, do all kinds of stuff that's like, I can do that, but it's not really my role. And it feels kind of yucky when somebody asks you to do something that's not really quite your role. Anybody ever have that happen? And let's see, too many priorities, like, so many projects going on and just trying to figure out what's my to-do list? What should I be working on right now? Yeah. And then lastly, too many meetings. Yeah. Yeah. So.
Don, do you want?
I was just going to say amen.
I love that. And we've heard a lot about over the last day and a half about engaging with patients and families in our work, in our projects. What are some common misperceptions that people with diabetes have when you're encouraging them to be part of your team through a QI initiative or a test of change? And how can we combat some of these misconceptions and communicate more effectively?
So I have two, again, with our survey that we just did, our pump survey, everyone just wanted to know, like, why do you want to know? And what are you going to do with it? I was like, it's safe, your information's safe. And we usually have a tagline that this is just for a small project. It will not go into your chart, but we eliminated it this time around and the questions came back again. So just really reminding them that their information is safe with us and it's not going to interpret their healthcare plan going forward. Another big one now is that we're recruiting families for our parent group, which we are intentionally pursuing diversity. And so the families, I have been selected to identify families. And so having that conversation with a family who may not identify with the skin color they are, or I know in their chart that their child has listed as LGBTQ+, but they don't know that I know that. And so initiating that conversation to get them involved in the group, you have to be very sensitive when walking into it. Not every practitioner is ready to do that. So just being ready and open to having conversations and knowing what they feel like.
Yeah, I think another thing that we hear a lot of is like, I don't have the time, or it's going to be a really big inconvenience. And so some ways to approach that is simply creating convenience wherever we can. So whether that's with the timing, with the location, with the modality, if we can do a Zoom, let's go ahead and try that. It's maneuvering ourselves around the needs of the family and just trying to meet them where they're at and accommodating them in that way. We also will sometimes hear, right, like why, or why do you want to hear from me? What do I have to say? A lot, it's empowering them of like, we really want to hear from you. Your voice is so valuable in what we're doing. And it's just so important for us to hear from you as our patient and on the receiving end of all of our initiatives. So those are some ways in terms of to what I picked up yesterday, which I'm excited to apply for our own clinic in terms of communicating more effectively, engaging the whole clinic staff. And I'm talking specifically here about our providers who have the trusting relationships and have that rapport with our patients, and having them, maybe give that invite into the QI initiative that we are trying to start or roll out. And with that, then, we can hope to encourage an honest and really, productive conversation instead of maybe just our QI team. I'm a new face, I'm more behind the scenes. So engaging that whole clinic staff with the providers who, again, just have that relationship with them.
Excellent lead into my next question. So how have you successfully engaged people with diabetes in your QI initiatives? And can you give some practical approaches or strategies?
Well, I don't get to work in the clinic area very much, but I get to work with the people that do, and they're interested in connecting, of course, with the patients and their families. And so one of the presentations that was made here at the conference was by one of our social workers that does a fantastic job, and she created a program called Family Focus Groups. And so she has 3-4 times a year groups of people come in and express what their thoughts are, their needs are, ask questions, has maybe information distributed on different topics that are of the moment for those sorts of people. And then we oftentimes, from my end, because I want to use that as a survey opportunity, we'll have one big question, or we'll have a couple of questions to ask their thoughts on it. And then we'll use those to help guide us in directions that we might go. So that's sort of a way we connect.
And then I'll
Sure.
So just to be simple, the same way the family focus groups offer, we, the parent partnership that we offered, we are giving them a Starbucks gift card every time we have a Zoom meeting. And we're trying not to do in person because of convenience, but at some point when they're ready for that, that's when we'll open up the door. So it's bribery.
Yeah, I was going to say that too, actually. Sometimes we will use a Starbucks gift card or just like a money card, but I think it's bribery, right? But more than that, I think it's like saying like, hey, you spent time to do this and we value you as a person. We value your time. So we're going to pay you for this. So yeah, that's one tactic that we've used. And we try to have, I'm not going to say we try to, but we should be better about having them at our project meetings. We had one project that we just met our goal, so it's closed. So we were having parent reps come to that meeting. So now we should do it for other ones now that we don't have any, since that was our last one. But we do try to have them at meetings and ask, like, think about which parents would be good or the patient, the children. So we either have them come to our meeting Or we have like voice of the customer meetings where, you know, they don't come every week, but maybe we would really like their feedback about it. So we'll invite them just to one meeting, or we could send them a document like, hey, what's your opinion on this? And we also, like, if we're having a design session or a kickoff meeting, like for sure including them in that, so that it's not just like co-producing, but actually like co-creating with them so that they're at it from the start. And then when we sometimes, just to like even motivate our team or to really hear what are their issues, we'll have like these voice of the customer to just hear their story and what their struggles were, and how we could apply it to our project. And then lastly, when it comes to the, we have probably a lot of your hospitals do, the patient advisory council. So we can use them. And then on our actual patient family experience survey, whichever one I'm sure your hospital uses, ours, it has this like question that they can like opt in if they want to be a part of further feedback. And then when they do, at any point, any team can reach out to that group and ask questions. And we've done that with the Diabetes Center before.
I just wanted to add one thing. When we said we were bringing in a parent group, a lot of our providers were like, no, they're going to say too much, or they're going to change too much, or they're going to ask more of us. So like, we are particular in saying like, this voice matters. And while you may not like the changes that will come from it. So I think even involving the clinic in knowing that we trust these parent groups that we're using.
We've struggled with this at our center. Very risk averse in Wisconsin. And there's just like a lot of concern about bringing people in. And it has just been a struggle. It continues to be a goal of our group. But recently we were like, we have to get some movement, right? And so we made a Qualtrics survey and made a QR code and just asked families to informally give feedback. And it just feels really good. Like, it's not the way we want to do it forever, right? But to be able to get some feedback, and people did respond, right? And they gave us answers, and it was very helpful to see their responses. And it just feels good to be making progress towards that goal and engaging people in some way. And we tried to also make a big deal of like, hey, we're part of the T1D exchange. Like, we are working on improving your care, so that we're being a little bit more transparent with our patients as well, or people with diabetes. I should not say patients. All right. So one of the major benefits I feel like I've gotten personally from my participation as a QI champion is the ability to learn from others and share resources. Can you share some resources with QI champions that might help them learn more about quality improvement?
Yeah. So I know we all come from various kinds of organizations, some very large, some not so large. So, okay, I'll be really fast. But at Lurie Children's, we created our own internal improvement framework. We modeled it off of 3 improvement methodologies. We pulled a little bit from the Lean DMAIC, DMAIC Six Sigma. We pulled from Lean, and we pulled from the Model for Improvement, which is the IHI methodology. So we created a toolkit that has like a gajillion QI tools, because I think when you're stuck, just go back to the tools. Our tools are aligned with our like phases of our framework. So like our tools that we use in current state analysis, our tools that we use in future state design. Anne has put that PDF on the T1D QI portal, and it's all linkable. So it'll link you to the Fishbone document, our template. There's a million templates out there, no right or wrong answer, but it's just one place you can go to get tools. I'm sure you have resources in your organization, but some people might not. So if that's helpful for you because you don't have organizational resources, I'll also just plug in, Don could probably talk a lot more about this, but there's great resources on the IHI website. Some are free. In fact, they have a decent amount of free resources. And then there's opportunities for training like a Lean Six Sigma, green belt, yellow belt, black belt. Those do usually cost money, but there's a lot of free resources out there as well.
Only thing that I'll add from a personal experience standpoint. So I here at Children's National, I'm wrapping up a quilt. It's called the Quilt Program, the Quality Improvement Leadership Training Program. It's a cohort of about 20, and we're from like every single corner of the hospital. about a 4-month program. We're paired up with QI coaches. We have data workshops. We are doing our own QI project. It's a fantastic experience, really, to be able to learn more and more aside from the IHI and the T1D exchange collaborative resources that have been available. It's been really helpful to have that hands-on experience. And again, with all of those different people in the room. So whether or not your hospital has something like that, I think it's just the broader recommendation of tapping into those internal resources that might be available at your hospital. So those, just the QI facility and whatever resources they might have and people that they can, loop in and help has been really valuable.
Yeah, I was going to say definitely what you guys already did, which is the internal classes that your hospital might offer. So if you don't know of them, look into them. And if you have taken them, like encourage others to. IHI Open School or just any of their links. I use that so much during my doctorate program. They have some really good resources there. And Cincinnati Children's does offer a course that people can, like external folks can take. So if you or a physician at your hospital wants to come to Cincinnati Children's and learn the methodology, and then you could bring it back to your hospital. That's another option. And I was just going to list off 3 books that I have really enjoyed reading. And it's a true QI nerd that you can say you enjoy reading QI books. But the 3 books that have really helped me learn a lot about QI, and I'll say the names, and if you want them, actually I can tell them again slower, but if you come up to me, but it's The Improvement Guide by Tom Nolan and Lloyd Provost, and others. If you guys have heard of that one. Understanding Variation by Donald Wheeler. And then this is an old one written in 2008, but just really laid the framework about QI, and that's called The Best Practice, How the Quality Improvement Movement is Transforming Medicine. And that's by Charles Kennedy. So.
Awesome. Thank you. Ori, do we have time for questions from the audience? Okay. That's what I thought. Okay. All right. So I think we'll finish. We have one more group panel question. And that's just, what's one piece of advice you would give to someone who's new to QI? We'll start down with Don and then we can pass it back.
Boy, if they're new to QI, the one piece of advice I would give would be to learn to love it. Learn to love it, because really what you're going to do is you're going to go out and influence a lot of people, and through you, they're going to have their first QI experiences. And so if I can help a new person love it and help others grow to appreciate it and not be afraid of it and love it, that's spreading QI itself. So rather than a particular tool, I'd start off with maybe an attitude of the heart, and then I'd head to the mind.
Yeah, that's great advice. I think don't get discouraged, because there will be lots of challenges and frustrations as a QI champion, and just to don't be afraid to say you don't know, or to ask for help or mentorship, or just to keep persevering and don't let it get you down. And then I'm going to cheat and do 2 advices, really use the QI tools. I've seen QI projects where they don't use the tools, and QI projects when they do, and the results and the theory is just so much more rigorous when the QI tools are actually used.
I love those 2. I'm going to say, keep the patients as your North Star, or keep, kind of the focus of the project as your North Star, and don't let perfection be the enemy of progress. Start small and just do something, right? Doing something and learning from it, whether it passes or fails, is better than doing nothing.
Ours is encompassed in being brief. I remember when we first started and we had our first meeting with Ori, and we had 30 patients in our first PDSA. She's like, smaller. So we were like, okay, 10. She's like, smaller. And we're like, all right, 5. Here we go. Which seemed minuscule to us, but it was easier to walk into QI. So, and also your emails should be brief. You should never have to scroll more than once when you're giving instructions to the clinic for them to do things.
I'd say surround yourself and ensure that your team is full of diverse experiences, opinions, roles. I think that, so much success of QI really is engaging with all those different people and making sure that you've got all those different experts in the room with you.
I get to work with new onset patients a lot. And one of the things that I say a lot, just maybe helpful, maybe not, but is like, diabetes is a marathon, not a sprint, right? Like it's not about getting it all right today. It's about making small changes over time that lead to living well. And so I think that's my advice too, right? It's a marathon, not a sprint. So take your time, get comfortable with the tools. I feel like maybe I'm just starting to get there, like, right, getting more comfortable in this group and understanding like the portal and the website and like all of that, because in addition to my normal job, right? Like we took on all of this stuff and it has been great, but giving yourself some grace to like get your feet wet and it'll take time. And when you look back, I feel like it'll be clearer looking backwards than it was maybe going forwards. So we definitely have time for audience questions. So I think our prompt was kind of like, what are challenges that you're running into with your QI work? But this panel has a ton of expertise to offer. So whether it falls in line with that prompt or not, happy to start taking questions and having a discussion with the audience.
I feel like you guys deserve a round of applause.
Great job for presenting, and really appreciated all of your feedback. Definitely going to do that finding joy in the workplace. That's really cool. I already sent myself the white paper. But I think the biggest challenge I have is I'm a nurse manager running clinic operations. I oversee 8 clinics. And these are my QI champions, many at this table. My lack of engagement I'll just say it, my nursing team is where I struggle the most. Getting buy-in is the biggest challenge I have. Time, I don't have the time. What else are you going to take off my plate? So I can do that. So I think that is, and the 3 of them come to me a lot, which is great. They're really good at giving me feedback, which I love. It's just then taking that and balancing the priority. They're all laughing because they do it constantly, which is great. But it's taking that feedback and balancing, and I constantly am balancing measures to figure out where to go first and what to do first. Any feedback or any experiences you could share with that?
All right, Amy.
This is like a really basic idea. And then I think Naomi has something to say too.
Yeah.
It was actually when I was learning about the joy in work that they put out this board. It's a communication board. And if you do feel like there's a lot of priorities that you have to hit, sometimes, I don't know, the strategic priority of the hospital, you really do have to do all of them and you just have to figure it out, right? But sometimes if certain individuals are coming to you, if you can just communicate to them, like think about a communication board, like it could be a electronic one or like a bulletin board, and there's columns and rows. And so the columns are like, here's what we're working on now. Here's what you said. Here's what we're working on. Here's what we're going to do next. And here's just some updates about that. And so you can put like the different projects, right? And so if one is like literally just on hold, you can say, hey, we heard you. We want to do this, but we're doing this one first. But just like a way to like communicate each of those different things for the different initiatives.
Yeah, my comment was going to be really similar with like prioritization, right? And I think as a fellow manager too, it's like, you know, I oftentimes forget sometimes that not everybody sees the bigger picture that I see in my head, because I'm having conversations with, 10 different people. And then, so I think that helps a lot with laying out the conversation or the bigger picture. And oftentimes I'll just bring things back to people like, so for these 5 data requests that DAR needs to prioritize, I, worked with our data analytics team and I prioritized them in this order. And for these couple of people, that was really exciting because theirs was at the top for these couple of people. But I laid out my logic for why I prioritized it that way. And they were all able to be like, yeah. And I was like, help me. What am I not seeing? What am I not seeing in this? So I think it's just really helping people see what all the things that you're seeing, and then laying out the bigger picture, and then really working with the team, and then getting back to like that what has heart. So if it's not something that like the organization's saying like you have to do this, are there ways you can be nimble and prioritize the things that the nurses really care about, that are really meaningful to them, and get engagement in that one thing, show some success, build up some confidence, and then the less fun things can come along the way too, right? Like, I don't know how much flexibility you have in that, but those are some strategies I can think of too.
I love both of these because they're explaining how we get our head around things, how you kind of get the scope and the lay of the land. I'll share with you two tools that were the most practical for me when I was running large things such as yours. One's a Pareto chart and the other's an effort impact matrix. So once you've got the scope of all of these different things, you can then take them, and an effort impact matrix says, how much effort would it take for our team to get that done in this time frame? And then how much impact would that have? And so you've created a matrix, and you can take 10, 20, 30 things and you number them, and then you put them in the matrix. And so you go first and do the ones that are the low effort, high impact, because those are the biggest wins. And then you schedule as a parallel the high impact but high effort ones. And then the ones down in the bottom left, which are the low effort, low impact, that's your low hanging fruit. You don't need a project, just assign somebody to go do that. And then the ones that are over on the other end, which are the high effort, low impact, you parking lot those, or you outsource them to another department, which is what I usually would do. So the effort impact matrix is your friend, and the Pareto chart is the way you quantify that. Because with a Pareto chart, I can come back and look at those issues. Let's say I've got quite a few in the low effort, high impact, but then a Pareto chart will help me sort out the number of times that's happening and how big an obstacle it is in the near term. So you might find that there are tools like that that'll help give you definition, and that gives you direction.
I'm not a manager, but I am often involved in the nursing workload kind of discussion and creating workflows for nurses. And one of the things that we often try to do is like quantify the work that's happening, right? Which for much of nursing work can be very difficult, especially if it's happening in an in-basket or it's very intangible. But like we've tried different strategies of thinking about the amount of time spent doing something, right? And often in the context of like making a business case for needing additional employees, like that's where I often get involved in that, of kind of trying to say like, what are we doing? Why do we feel like we have insufficient FTE? I mean, you're a manager, so this is not a novel concept to you, but we do a lot of that in our department, or trying even like school orders, right? Like trying to quantify how many school orders we've done, when did we do them, how much time does that take, how can we make that process better, spread it out. So, all right. Next question. You're first.
Thanks. I'm Barbara Liebman from UCSF Pediatrics. Thanks everybody for your presentation and contributions. I feel like I'm in exactly the right room, hearing what I need to hear most. So thank you. I guess my question is, I work for the quality improvement department in our organization, and I support the diabetes program primarily. And trying to figure out which projects to even start working on is difficult because of the engagement question. If we ask the department team members what they want to work on, they'd probably say nothing because they don't want any more work. And so what we find is that we're having to come up with quality improvement projects, because that's what I was hired to do. So I work with our QI physician leads to come up with projects, but they're not necessarily projects that to the team that I support. We're coming up with projects often by US News and World Report metrics that we see there's a need, but trying to kind of create that overlap and that meaning for the team when it wasn't organic and it didn't come from the team itself is challenging. So I guess if you could just address projects and how to bridge the gap.
Great question.
Combine the two, okay.
My question is kind of almost the opposite. So the fellows come to me with exactly what they want to do, like their QI that they want to do. And I like guide them, and I'm the ones that I'm super involved in. I can help and I have the tools and whatnot. But what would you give, like, I guess, like the tools? Like I just never, I give them like an Excel sheet that Ori last gave me. I love that one. And then I kind of send them on their way. Like, what other QI tools would you give them? And some of them come back to me, but most carry on because they're fellows and so busy. So.
All right. So a little bit about how to prioritize and then the tools that you can provide.
So we are 3 years in, and we kind of started the program with what do we do first? There's a huge difference between the joy behind what the exchange gave us in terms of data compared to US News. We've been really involved in that before, and it's very competition based. Like, we got to make this number look as good as possible. There was nothing about the data from the exchange said that. You really saw something that you could fix. And so we let our data lead us into our first project. So I'm not sure what that looks like for the numbers for you guys, but whatever people are bringing or not bringing, let the numbers help you guide that way.
Either way, you go.
All right. Okay, it kind of addresses both, and I'll go to yours, Barbara, and say this. The issue kind of is portfolio. Okay, that remember, when you're doing your QI projects, you need something at the strategic level, which is going to make the C-suite happy. And in this day and age, that's whatever your US News and World Report metric is in your area. Okay, and so then you come down into the management area of supply and demand or capacity to handle the workload that's coming through. And what you're looking to do there is to find ways that you can reduce work burden for the people and the flows. And usually people do that by trying to correct a bottleneck, which is a short-term containment issue because bottlenecks come and go. It's high census day or not. When in reality, what the middle manager needs to know to do is what they call constraint management, because where you're always getting hung up is that one place in your workflow that can't go any faster or can't process any more. It's a fixed constraint. So everything has to flow into it, and then that becomes your pacemaker for everything that's coming out of it. And so for your portfolio, for a manager, you want to help identify where the most aggravating constraint is that's causing you to lose people and all that sort of thing. Sometimes, by the way, it's the manager. And having been a manager, I say that could be that, but to identify that. And then when you think of the people on the front line, you want to have something going on in QI for them. And usually it's finding a standard that people can rally around and practice consistently enough to where they're not constantly looking for something. They're not constantly being annoyed and aggravated. Those are the things that I find help. And if we kind of turn that upside down, I think it maybe helps with yours too.
Yeah, I was just going to say real quick, I think we grounded on like what we felt was like kind of the most foundational or fundamental, you know, and so we really knew like the evidence is very clear that like CGM use has a positive impact on outcomes. And so we started there and we knew we had room for improvement there. So I think it's like back to like speaking to people's heart too, like can US News on the endocrine survey actually does a nice job of looking at equity and starting to grapple with like the equity domain. So I think if you can really reframe something and pose it as like tugging at people's heartstrings a little bit, or like, this is the right thing to do. I think that helps with fellow projects. We can talk more. I think some of the most important aspects of QI are the current state assessment, however you get to a fishbone diagram, recognizing the barriers or process mapping or whatever. I would share those tools with them. And then a key driver diagram. I think it's our roadmap. It's our, you know, you have literally your aim statement to your barriers, to your interventions, to your metrics can all be on a KDD. And I think, you know, those are some of the tools that I love when fellows and residents like can ground themselves and learn those tools. Glad to share some of that.
You say something?
Go ahead.
For the projects, I 100% agree with what's been said so far about choosing a project. And one more idea maybe would be if the posters are already gone. I was going to say, look on the walls out there. Wish they're gone, but I know we're going to be sending them out afterwards. So maybe if you glance at those and see what other of us in the collaborative are working on, you could choose, if you see themes, maybe choose one, because then you have people to reach out to who can give you ideas of what we've tried and worked. And it's just really a collaborative effort, which is why we're here, right? That's what I'm supposed to say. Ori is going to give me money when I walk out the door for saying that. But they're the tools, 100%, like a fishbone or something we use actually instead is an SFMEA, it's called. Afterwards, I can give you my card and I can email it to you. But what's really cool about it is it maps out the process in 7 steps that you're trying to improve. And then on the bottom, it has what are the failures that could happen at each of those steps. And then at the top, you just brainstorm ideas of what could help mitigate those. We call it failures, which doesn't sound very nice, but it's typical QI manufacturing failures like an FMEA is. Key driver diagram 100%, because that's the what needs to be in place and the how to do it, right? And then when you said Excel, I'm wondering if maybe you mean a PDSA worksheet, because that's really good. Once they have, some people get confused and think that's their whole project is PDSA, the whole project, but no, it's for each intervention they test, which is bringing me to make sure they have a measure, a key driver, but also a run chart or a line chart that they put their process through.
Were you gonna say something? Oh, go ahead. Okay.
I think we're.
Are we done? All right. Thank you guys so much. Thanks for coming and your great questions, and thanks for your contribution.